My name is Kayla and I'm going to perform drawing up insulin skills video. So first I would verify the healthcare provider's order. I would verify my 6 rights of medication administration, which include right patient, right route, right time, right drug, right dose, and right documentation. I would check the medication order in the EHR. Next, I'm going to enter the patient's room and introduce myself. Hi, my name is Kayla. I'll be your nurse today. Can you tell me your name and date of birth? Check the wristband, and do you have any allergies? I'll go ahead and note and document any allergies. I would check their blood glucose level and let them know when their next meal is arriving. I'm going to let the patient know that I'm going to be administering insulin medication injection subcutaneously. Per the provider's orders, you'll receive this every morning before breakfast. It's used to control your blood sugar. It works by helping to move sugar from the blood into other body tissues where it's used for energy. It also stops the liver from producing more sugar. You may feel slight stinging and burning as I'm injecting. Some common side effects include redness and itching at the injection site. You may feel some adverse effects such as shortness of breath and If you experience any adverse effects such as shortness of breath and dizziness, please report them to me immediately. Do you have any questions? Okay, so I would perform hand hygiene. I'm going to go ahead and put my gloves on. I would gather my insulin vials from the medication cart. I'm going to compare the labels with the MAR. I'm going to check the expiration date. I'm also going to inspect for any altered color. I would make my dosing calculations here. So we are doing 4 units of the short-acting regular insulin and 8 units of intermediate insulin for a total of 12 units. And I would ask another nurse to verify. Next, I would grab an alcohol swab. If they're new vials, I would take the caps off. I would clean the tops of the vials. Before that, I want to verify the orders in the MAR and EHR. I'm going to grab my vial. Do it to the next vial. And grab an alcohol swab, clean the top of the cap, grab a new alcohol swab and clean the top of the cap. Next, I'm going to go ahead and grab my syringe and needle with the cap still on. I'm going to pull back on the plunger to get air to the intermediate amount of 8 units. I'm going to take the cap off and we're going to stick it into the intermediate vial, and we're going to inject the air without the needle touching the solution and aspirating any medicine. We're going to take the needle out. I'm now going to pull back on the plunger to the amount of the 4 units for the short-acting insulin. I'm going to put it now into the short-acting regular insulin. I'm going to inject the air into that vial. I'm going to turn it upside down and go ahead and put the air, get the total of 4. I'm going to remove the vial. And I'm going to tap on the syringe to release air bubbles and push gently on the plunger to release the air bubbles. I'm now going to verify the 4 units against the MAR EHR. I'm now going to place the needle back into the intermediate vial. Check the MAR EHR to make sure we got the total of 12 units again. And now we're going to fill it to the 12 units. I'm going to remove, release any air bubbles, and gently push on the plunger to release any air bubbles. I'm going to keep the needle clean and use the one-hand scoop method. If I was doing this away from the patient's bedside, I would label it with the name and the dose. So now I would remove my gloves, place them in the trash, perform hand hygiene, and document.